Today we are covering the mental health assessment, a critical component of the NCLEX-RN exam. The board wants to know if you can quickly and accurately assess a psychiatric patient to guide care, and most importantly, to ensure safety. The Mental Status Examination, or MSE, is your head-to-toe assessment for mental health. Exam questions won't ask you to simply list its components. Instead, they will give you a scenario and expect you to interpret the findings. For example, if a patient with schizophrenia is described as having a flat affect and loose associations, you must know this means they are showing no emotion and their thoughts are disconnected. This assessment directs you to prioritize actions like reorienting the patient and maintaining a safe environment. The number one priority in any mental health scenario on the NCLEX is always safety. This means you are constantly assessing for suicide risk and the potential for violence. The exam will test this through priority-setting questions. Imagine a client admitted with severe depression tells you, "I'm just so tired of it all. I don't think I can go on." The question asks for the nurse's immediate response. The options might be A. Tell me more about what you're feeling. B. I'm here to help you through this. C. Are you thinking of harming yourself? Or D. Let's discuss your medication. The correct answer is C. A common exam trap is to choose a generally therapeutic but indirect response like option A. However, when there is any hint of self-harm, your absolute first priority is a direct risk assessment. You must ask the question directly. The same applies to violence potential. If a patient is pacing, clenching their fists, and speaking loudly, you don't ask them why they are angry. Your first move is to ensure the safety of the environment for yourself, the patient, and others, which might involve removing other clients from the area and using a calm, de-escalating tone. Documentation is another key area. The exam expects you to use objective, behavioral terms. Instead of charting, "patient is aggressive," you must write "patient threw a chair and yelled threats." This is crucial because it's factual and avoids personal judgment. A frequent point of confusion for test takers. To help you remember how to approach these assessment questions, use the mental shortcut ACT. It stands for Assess, Clarify, and Take Action. First, assess the patient's objective and subjective cues. Is there a safety risk? Then, clarify any ambiguous statements, especially those related to harm. Finally, take the priority nursing action, which is always addressing the immediate safety concern. Understanding defense mechanisms is also vital. If a question describes a patient who, after being diagnosed with a terminal illness, is cheerfully planning a long-term vacation, you should identify this as the defense mechanism of denial. The correct nursing action isn't to confront the patient with reality, but to provide support and create a safe space for them to eventually process the information. The therapeutic use of self means using your personality consciously to form a relationship. The NCLEX will test this by asking you to differentiate between a therapeutic and a social response. A therapeutic response is patient-centered and goal-directed, while a social one is not. Always choose the option that maintains professional boundaries and focuses on the patient's needs.